Welcome back to Below Facts Alive. With us is Glenn Wilson of St. John Ambulance and Fernando James of the St. Lucia Fire Service. We were talking about certain conditions and how they are dealt with so that, of course, we can prevent worse things happening. Glenn, can you tell us, heart attacks and strokes, how do we identify what they are? Because I think it's very easy for people to think, well, they're having a heart attack, or they think it's the same thing. Are they?
Very much so. In our local context, persons usually refer to the other, one or the other. As a first aider or as a first responder, one of the things that you're not allowed to do is to diagnose a casualty. A doctor does that. So therefore, in responding to an emergency or a situation where you have a casualty, you respond to the signs and symptoms. The signs would be what you see, and the symptoms would be what the casualty tells you that they're feeling. And those are the things that you'd pay attention to and provide first the initial help for. However, you can be able to differentiate from the two, whereas with this may have similar signs and symptoms, but with a stroke, it's happening in the brain, which is part of the brain is starved of oxygen, so there'd be pain associated in the head, versus a heart attack, or what is called angina, where pain is associated in the chest and probably from the arms to the chest. So that would be the difference. Some of the signs and symptoms would be similar in that the person would show signs of shock, sweating, clump, damp skin, discoloration of the lips, the ear lobes, the fingertips, and the tongue, and so forth. And of course, the main focus would be the pain that is vibrating from the arms into the center of the chest. With angina versus a heart attack, the difference would be that with angina, if the casualty is rested, they start to feel better, because angina happens when an artery in the heart is partially blocked, whereas a heart attack, it's totally blocked. So that's the difference between.
Okay, and what if you cannot get the person to make any sense at all?
So what you'd respond to would be what you can see. So if they're unable to communicate to you to tell you what is that they're feeling, you will respond to the signs, the things that you can see about your casualty. So the damp, clammy skin, the discoloration, and so forth. There might be a droopy side of the face, the pupils might be dilated, and things of that sort. There might be speech problems or arm weaknesses, and so forth. So these are the things that you would respond to in providing that initial care to your casualty. And
Fernando, how often is it, if you go out to attend to something like this, that the actual people around the person who is suffering, can they accurately tell you what's been happening?
I would say 95% of the time the family members or friends or bystanders or work colleagues are usually not sure what is happening with the patient or with the victim or the friend or so forth. They recognize that the victim or the patient is in pain and maybe unconscious, or maybe having an ill look feeling about them, and they're usually not sure. But
what can they do? What should we do? Let's say we are together and, you know, a family member just displays all these signs that Glenn just described. What can we do?
Well, what you can do, one, is try to stay calm and try to be sure about yourself. And secondly, try to make sure that the environment around the patient is safe for you to provide any first aid care. The next step is to get a phone and call 911. Most likely, everyone has a phone or many phones. So it is not in the past whereby you need to get a fixed line, but most likely everyone has a cell phone on them. So the next step is, of course, is to call 911, and whereby the local dispatcher on the other side will give you basic first aid life-saving instructions.
Okay, but how, you know, sometimes we don't know how we are going to react in an emergency, and some people just freeze. Some people start screaming. Sorry, but
so.
Yeah, but a lot of
common.
people, they start screaming before they actually pick up the phone. If someone has that reaction to start screaming, what does that do to the person who is suffering?
Oh, definitely to the person who is suffering, it will make that person suffer even more, or be even scared to see that their loved one, since they may be having a heart attack or stroke, but their loved one is now in a panic attack, and that will make that sick victim even more sick, because he will see, well, wow, his loved one is really frightened because he's having a heart attack or stroke, and that will just expound on the problem even more.
I think when these things happen, people don't realize that whoever is suffering, it doesn't mean that they've now suddenly gone deaf or they can't see. They are aware a lot of the time. Some of the times they're not, but a lot of the time they're aware of the situation around them, which is why when we say stay calm, there's a reason. I think sometimes we just tell people stay calm, but we don't say the reason why. So the reason why to stay calm is that the person who is suffering, most likely they're aware of what's happening around them, and you yourself is sending them to be more anxious than they already are, and perhaps it could be fatal because they're worrying. If, for example, they suffer with high blood pressure, I suppose that's going to do something with that as well.
I just want to explain on that too. With heart attack or stroke, these are life-threatening emergencies, and they usually result out of two most leading causes of medical problems. That is diabetes and hypertension. They are the leading causes of heart attack and stroke, not just in St. Lucia or in the region, but in the entire world.
And so many of us in St. Lucia suffer with those things. So it's important, if you have a family member or a friend who is suffering with these things, it's not just a matter of knowing that they suffer with it, but knowing what to do should the situation occur. What if someone who's diabetic hasn't taken their blood sugar on time, and so they may not have go into a stroke or heart attack, but they will show other signs? What will they show, and what can we do to help?
Patients who suffer with diabetes, usually if they would be on medication, and most likely they could be on tablets, oral medication, or on the injection, what we call the insulin. Now, when they have a low blood sugar, most likely that they may have been vomiting, or they have not eaten on time. And usually we find out a lot with the elderly population. They probably would have had breakfast, and later on in the day, maybe like mid-morning, go and sleep, and when it's due time for lunch, they will still be asleep. And on maybe a hot sunny day, you may find that patient very cold. Yet still it's hot outside, hot inside, but they feel very cold to the touch. And being that, of course, one of the very classical signs being that the skin will be very cold, very clammy, very moist. And of course, you'll find that there is no sugar that the patient needs. No sugar is going to the brain. Diabetics also suffer from high blood sugar, whereby they eat on time, but they have not taken their insulin. And of course, they may have an infection, and usually associated with that will be a very high fever. Their belly will be very painful, and of course, their heart rate will be very irregular. You find again, in this situation when the sugar is very high, they will most likely also be very dehydrated. They'll have lost a lot of fluids. By vomiting a lot, you most likely have a lot of electrolytes, a lot of sodium, potassium, chlorine, all that have been exhausted.
But when do we know it's time to call you or time to call the hospital? When do we know? How, as onlookers, how would we know?
When it's time to call us, it's most likely, one, they may find the patient unconscious, or if the patient is conscious, he or she may be acting very unusual, as if they may be having a seizure, or they may be acting very erratic, or the patient may be complaining of severe belly pain and feeling very hot to the touch. And by gathering the information on if he or she is diabetic, and he or she would have known that he did not take his insulin on time or had not eaten a meal. Okay,
but Glenn, when you train, what is the questions that most people ask you in terms of they're not sure what to do?
Just to expand a little bit on the diabetic situation, I just wanted to clarify that Fernando mentioned the low blood sugar and high blood sugar situations. That does not mean you're diabetic. Diabetes means that your body is unable to produce its insulin naturally to regulate sugar in your body, then you become diabetic. Because anybody suffers from high or low blood sugar. You've not eaten for the day, you will probably suffer from signs and symptoms of low blood sugar.
And the other thing about being a diabetic, it doesn't mean that you're born with it or you have it young in life. You could actually develop it.
Very much so.
So you need to know how to look out for those signs.
Very much so. Now the thing is, a first aider is unable to tell whether the casualty is suffering from low blood sugar or high blood sugar. Low blood sugar, one of the signs is that the casualty can be mistaken for a drunkard because they'd be staggering about the place like they're drunk. In addition to that, if you're able to smell their breath, it will smell fruity, like they just had mangoes and things of that sort. And because you're unable to tell whether it's high or low, all you need to do is to give them a sugary drink. Because even if it's high, the sugary drink will not get it any higher. it's already high. But the situation calls for that if it's low, which is what takes you into the diabetic coma, it is better that you address that situation rather than the high blood situation. So for persons who are diabetics, and like you mentioned, some of the signs would include and the symptoms, the nausea, feel like vomiting and things of that sort. All you do, you administer something sugary.
Okay, and then you go to the doctor or
Yes,
you call.
yes,
Okay,
yes.
so that
Two more
helps.
things again is that, well, you may not see this in St. Lucia, but in other parts of the world, you find that a lot of diabetic patients do carry a sign or a bracelet or a necklace that says they're diabetic.
Okay.
And also, right here in St. Lucia, you find the patients now, or maybe many years before, and they still do carry sugar tablets, or even what we call a glucose paste or sugar paste. And this is where you may put this between the cheek and the gums for a patient who will be suffering from low blood sugar. Not necessarily he or she may be diabetic, but most times we find a lot with diabetics.
Well, Fernando, we're going to a break and we're going to be saying goodbye to you, but is there anything at all that you feel that our viewers should know about some of the symptoms? Or, yeah, anything when you go out, what is problematic?
Well, two things. One, with drivers on the road, especially with not just bus drivers, but drivers or members of the public. I find that on our roads, we do not take due care and caution in driving, whether it be motorcyclists, bicyclists, or motorists, and that is where the situations arise or the incidents. Secondly, I find that members of the public should take due caution to themselves, because you find a lot of people take rides at the back of flatbed vans. And of course, those vans are insured, but you are not insured because you're not a body, you're a human being. And when an accident does occur, which is not an accident, because the driver or the driver should provide due care and caution, it will be your life at risk because you shouldn't be at the back of a flatbed van. And thirdly, drivers, when you have children in your vehicles, they should not be at the front of the vehicle. They should be on the rear seat in a car seat. Too many times we see babies or infants and small children in the front seat, either by themselves or with an adult or a teenager. All infants or small children should be in the rear seat at all times.
And those were great examples of the saying, prevention is better than cure. Thank you so much, Fernando, for being with us tonight. That's Fernando James from the St. Lucia Fire Service. When we return, we welcome Mabius Francis, the safety specialist investigator also of the St. Lucia Fire Service. Stay with us.